Welcome to the live video. I'm Nurse Aisha. If you're joining me for the very first time, I say welcome. Sorry, this is not the original, the official video we wanted to make, but I happened to have put the other one on private setting. So I'm sorry about that. I was notified and I had to change it. Welcome to the video. Welcome to the video. If you are joining me for the very first time, thank you so very much. Good evening. Good evening. I'm Nurse Aisha. Good evening. Today we are going to be talking on report writing. Good evening. Good evening. Good evening. How was your day today? Please, no matter where you're writing from, just leave a comment so that we might greet you and extend our love and wish you the best of today. It's evening now in my location. I hope it's the same for you. Good evening. Good evening. Good evening. Good evening. Please leave your comments so I know who is on the line. Good evening, madam. Good evening, Karen. How are you doing? Which team are you? Team A, B, or C? Good evening. Good evening, Ka. I'm Team A, Karen. All right. You're welcome to the live video. I see now. My phone was not, I'm not seeing, I don't know if it's my network that is disturbing or something else. Let's just be patient enough and wait for another person to start. I start even if I have to start just with you, because it's going to be a whole lot of breakdowns and I'm hoping for the best today. How are you doing today? I hope you had a good rest. Hey, Lada, good evening. The one that the leg is paining. Oh, I'm so sorry. That is why I'm trying to get the name. I'm sorry, Karen. How are you doing now? I asked yesterday and they said that your leg was a little bit better. Love you. Thank you so very much, Lada. How are you doing? How was your day today? Karen, how are you? How is your leg now? So we have been doing a lot of report writing, and it's quite unfortunate that you have not been around, but I guess we will make up for that, okay? All right. So are you sure to be on duty on Saturday? You're welcome, sweetie. Are you going to be free to be on duty on Saturday? Welcome to my live video. If you're joining me for the very first time, I'm Nurse Aisha, and today we'll be talking on report writing. Good evening, good evening. Karen, if you're online, come on so that we start. I'll start with you for the purpose of others had already been introduced to the topic, so they are coming now for their revision and dotting of T's and I's. So come right ahead so that we can go through this with you. And then you'll be able to understand why certain things are done the way they are done. Open the door. Tell mommy boy that she should connect me.
On this phone or this big phone?
Probably. Good evening, good evening. Remove it. Remove it, Joel. Good evening. If you are joining me for the very first time, I say welcome. Okay. Mama is asking how is Desmond and Joel.
You're not connected.
No, Mom, but
You know, this phone has started disturbing now. Boy, open the door. I don't know, you have started.
good evening, good evening, good evening. If you are joining me for the very first time, I say welcome. Sorry, the network is a little bit shaky. This is how we get to cope in this side of the line. I hope you cope. Karine, if you're online, let me know so that I start with you and then the others can join me for me to do the revision for everyone. Okay? Since you have not been on for some time, it's good that I break it down for you, and then when everybody's around, it makes it easier for you. Good evening, good evening. If you're joining me for the very first time, I say welcome. Please take some few seconds, say hello so that I might greet you depending on your location. Where are you watching me from? Yes, ma'am, I'm online. All right, Karen. Are you having a book? Are you having a pen? Because that is one of the instruments you'll be needing today. And I'll need you to constantly be communicating so that I understand that you are getting me. All right, you've not been at work for some period of time. A lot have been done without your when you were not present. So I want you to at least catch up with this. Today we had a revision for, we had our first report writing and you were not there. So we are doing a revision on that and to see that everyone has a basic and understand exactly what report writing as a nurse is all about. It is possible for you to be a student nurse and still know how to write report. And it doesn't matter whether you're in level 100, level 200, or level 300. Is that understood? Karine, are you online? Have you gotten a book? Do you have a pen with you now? Good evening, good evening. If you are joining me for the very first time, I say welcome. Here is Nurse Aisha, and today we are turning students into professional writers. Yes, ma'am, with you. All right. Helen, thank you so very much. Good evening. How are you today? Thank you for joining again. All right, Karine, now that I'm with you, today's topic is from a student to a pro. Nurses report writing. That is what we are going to be talking about. Nurses report writing. And that we are going to start with introducing what you understand as report writing. As a nursing student, I know that is very complicated when you get on duty and everyone is running left and right and they are writing things that you don't understand. At the end of the day, you might be following up, you might be working with the others, or you might be assisting in the best way possible, but you don't understand what is going on. You are not given the details because sometimes it's not because the senior nurses do not teach you, but it's because they don't just have that time to come back to you when they have done all those things that they want to do. You can agree with me now where you are present for internship now, our schedule is very choked and it is more complex and complicated. with that type of chook schedule, you come to realize that it is possible for us to underlook, or it is possible for us to be so busy and not come back to check on what you have, or to check on whether there was effective communication and learning. So let's dive straight to it. What is report writing? Please, if you are joining me for the first time, just say hello. You could be my student, you could not be my student, but the learning environment is a learning environment. And I would love to extend greetings depending on where you're watching me from. Now, to introduce report writing is a crucial aspect in patient's care. We need to understand what report writing it is. It is the process of documenting every procedure that was conducted to the patient. So when you think of I need to care for somebody, and as a nurse, and for the fact that our duties are never permanent, we need to always hand over care to the next nurse, then we need to have a perfect report. Because this report is going to assist, is going to help us so that we might be able to communicate with both the nurses, the doctors, the administration, and most importantly, the patients. Now, to start with, what is the purpose for report writing? Why is it necessary? This one. Stop what you're doing and do only what you're supposed to do that for. What you are doing for the purpose of report writing, we need to pen down the reasons for why we as nurses must do a report and must do a perfect or a good report for the next team, for the doctor, for the patient's update, for the patient's upkeeping, for the patient's well-being. Welcome to my life. I'm Nurse Aisha. Take some few minutes to extend your greetings so that I might greet you in a language that you understand. So the first purpose for report writing is communication and continuity of care. Karen, are you with me? The first purpose number one for report writing, it is communication and continuity of care. Now, when we talk about communication, what are we talking about? When a patient is brought into the hospital for the first time, and as a nurse or as a doctor, you attend to that patient. When the nurses are about to do their report, they are doing their report to hand over this patient to the next team and to the night doctors, or to the nurses consultant that will be in the night. So you do not want them to come and they start duty when they don't understand what is going on with your patient. So it is very necessary at all point in time that your report is very precise, that your report is detailed, and that your report has every information that is needed by your colleagues, by the doctor, and for the continuity of the betterment of that patient. 2, I said it is equally for the continuity of care. Because if a patient comes to the hospital with high blood pressure, with high sugar, or with low blood pressure and low sugar, it is necessary for us to identify that this patient needs continuous follow-up. We need to be checking her vitals. We need to be checking the output and the input. Then we need to administer treatment. We need to give blood transfusion at a particular time of the day. So all these things, if you do not pass it on, then you are going to be having nurses on duties that do not know what they are doing, or where they are going to, or for what purpose they are at work. It is necessary for you to be able to pin down every important aspect as a nurse, as a student nurse, so that the others can effectively continue the care in which you are entrusting the patient to. Now, point number 2, what is another purpose for report writing? We have legal documentation and accountability. Legal documentation and accountability. Karine, are you with me? I know that Karine is online. I do not know if there are other students online. So you need to indicate that you are online so that I can talk to you and I get to know if you understand what I'm talking about. As for the other population of YouTube, you allow them keep coming in and going. I will greet them, and if they want to stay, they are free to stay. If they want to go, they are free to go. But as a student, you need to be in this class, and I need to know that you are understanding what I'm talking about. So for the next purpose, we're talking about legal documentation and accountability. For legal documentation, there are period on time. I know that because we are probably in a developing country, you do not realize or you do not see doctors or patients or nurses being dragged to court for negligence, for malpractice, for something they did that was not correct, or a medical error that is very, very fatal. Thank you very much, Karen. It's very good that as I'm getting the update, I know that you are working with me. So when you make this type of error to a patient or to a family that understands exactly what healthcare is all about and what the procedures and systems are all about, they will file for a legal case. And the only way you can back yourself up if you did the right thing is by presenting the document that indicates what was wrong with that patient. So if the patient was in the hospital and because of one thing or the other, something happened, this is when you are going to legally indicate that, no, I am not on the wrong. I did my job. I did my part. It is only but unfortunate that we lost the patient. Correct. Thank you so very much, Pandi. I'm so grateful you're in my life today. Good evening. How was your day today? So you get to understand. We need to know, you need to always pen down everything you are doing to a patient so that you can defend yourself in days or in raining days or the time where you start being dragged like a dog. Because if you do not have any documentation, then no work was done. As a nurse, as a professional nurse, as a student nurse, you need to understand that you are accountable. You are held accountable for each and every patient that is under your care. I'm sorry if you're not seeing me properly. Real, good evening and welcome to my life. If you're not seeing me properly, I'm sorry. I really have just one bulb I'm using here, and I think I see myself. So I thought it's good. So maybe you're using a high quality phone, but just try to manage it. Thank you so very much for understanding. I'll grow up gradually. All right. So you need to be accountable for whatever you do. For you to be able to say that I did HB and it was 5 and there is need for blood transfusion, we need to see the HB that you did. We need to see the results. Because nursing is not about you telling theory. Nursing at the job site, nursing in the field is about evidence based. So you need to tell us with certainty that by 2 a.m. I took the blood pressure and it was 40/30. And by 5 a.m. I took the blood pressure and it came down to 20/10, which I know very well that patient will already be on his way to the other side of life. But you need to tell us, and we need to see that you actually did it. You need to tell us that when you checked the BP at first and it was low, you did interventions, and those interventions, we need to see what the results were. You need to go back to make sure that your interventions had yielded good effect. Of course, accountability is for the individual that is supposed to carry on that duty at that moment. But now responsibility is for the entire team. And that is why at some point in time, you will realize that even though an individual in a particular team has committed an error or something did not happen right, the whole team is taking responsibility for that action. Or the leader of that team is taking responsibility for that action. So it is an individual accountability, but a generalized responsibility for each and everyone in the nursing health team at that particular moment to carry on a perfect and a beautiful job. Karine, are you with me? Does that make any sense to you? Karine, are you with me so that I can break down the accountability? What do you need to be accountable for? Karine, are you online? All right. So when you go under accountability, I want you to make generous notes on this aspect. Yes, I am a lecturer in the university, even though I'm a nurse too. So when you want to make general notes on under accountability, the first thing you are taking accountability for is clear records of actions that were taken. I get you. So I know that you're online for sure. But you need to be responding each time that you have a sensible network. For under accountability, you have point number 1, clear record of action taken. So you need to tell the people on duty what you did, when you did it, and how you did it. All right, that is good. So when you are able to tell someone you have worked with me and you realize that when we are taking over shift and there is a patient that is indicated, this person is having high temperature, this person is having high BP, this person had a glycemic of this, or the malaria trophozoite for this patient is quite high. So you already know that there might be possibility for conversion. You need to start monitoring that patient. And I'll always tell you people, go and monitor, bring back the results to me. Or I did the monitoring myself. If it is in a situation where we are talking about HB, where we are talking about the BP. And if it is a BP that we have to control with medications and then follow-up checks are done to make sure that the blood pressure level is under control, you need to systematically do this and then record. You cannot tell me as a nurse that you check the record. That's what I'm talking to you.
Auntie.
That you check the records and those records gave you some values and you cannot tell us when and you cannot tell us what you did as your action plan. I'm sorry, you were not on duty. We go to point number 2, assessment met. When you are handing over shift the next day, what were your assessment? So according to you now, how is the state of the patient? Is the person getting better? Is the person responding to treatment? Do you think that the doctor would need to reassess this patient in the morning? Are you on your way to recovery? Is the patient probably supposed to be discharged on that day? Etlin, thank you so very much. You are my number 1 biggest fan. Kisses, sweetheart. Welcome to the live video. Today we are talking about report writing, and you guys will soon be going in for your internship, so make sure you stay in class. So this is one of the things that you're going to be realizing. What is the state of the patient? How well is this patient? How good is this patient? Do you think, according to you, this patient will need to go in for maybe an echography the next morning? According to your assessment, do you feel like the patient needs glycemia the next morning? And if you think that that is the best approach to the medical care you want to give to this person, you need to do the glycemia in the morning so that you can present your report. Because of what you have observed during your period of night shift, you had come to a conclusion. Okay, let's take for example babies that are having very high temperature, neonates that probably are now getting into early neonatal sepsis, and you have monitored this temperature throughout the night, and the baby is still having a temperature of 40-39. Are you just going to get up now and tell the doctor in the morning or tell the other team members the baby had a temperature throughout the night and we control it or we did not control it, without necessarily telling them that because of the BP or because of the high temperature you had throughout the night, you decided to check for CRP that morning or for malaria test that morning, which came out positive or which came out negative, and you are sweating or you are pleading that the doctors can now go with follow-up care or admission after probably you had equally done counseling to this patient. So you get to understand, you need to understand what you have to do at a particular time, a point in time. You're very welcome. Thank you so very much. I hope you stay in class to the end of it. So after the assessment, we'll be talking about patient's response. How is the patient responding to treatment? According to what you have done, the patient was having a temperature of 40, and then a paracetamol 1 gram was given. Did it yield much effect? Did it yield little effect? At the end of the day, what is the temperature now? So you are giving me the report. You need to tell me that by 12 or by 2 or by 9, I took the patient's temperature. It was 40. Paracetamol 1 gram was safe. And since it was 10, now by 2, which is 4 hours after, I rechecked the temperature and it is stable. Then actions done, observation done, monitoring done, and everything is on point. Then you are about to hand over shift. You are telling people what you did. If the sugar level was very high, what did you do? You flush the patient's system with normal saline of 1000 cc, of 2000 cc, of 3000 cc. What did you do? And if you have flushed the system with 1000 cc, at the end of the day, how did you manage it? Did you catheterize the patient? Or did you send the patient on? Did you monitor the output? Because if you are flushing the input, you should be able to monitor the output. So this is one thing that you need to understand. Karine, are you with me? Ethelyn, are you online? Why are you in class today? What are you writing tomorrow? Ethelyn, what are you writing tomorrow? So this is how much it is needed for somebody to understand the different stages. We are talking about allowing evaluation as well as improvement. What is the final evaluation this morning? Because of how fine and how fit the person is, because how responsive the person has been with their treatment, you feel like the patient is there's a necessary for evaluation and discharge. Then the doctor already knows that, okay, there's this patient in the ward, their treatment is over, there was good responses, and they are able to go home. Sorry for the network disturbances. I get, right? When you're here, it is always like that. But we give God the glory. It can't stop us from learning. All right. So now point number 4, we have spoken about the first purpose, which is communication and continuation of care. We are talking about the second. And the third one, we are now talking about quality improvement and research. Quality improvement and research. Under quality improvement, we need to understand the progress of the patient. A patient has been admitted in the hospital for 5 days. A patient has been admitted in the hospital for 4 days. They came with vomiting, they came with fever, they came with abdominal pain as they are presenting complaint. After the 4th day, you still present the patient for having temperature, for having abdominal pain, vomiting still continues, and there is active treatment carried on, there is a problem. And if that is the case, research needs to be done. We need to go back to finding out, is it for real the diagnosis we gave this patient and we are treating? Is that what they're actually suffering from? Because if that is not what they are suffering from, then you need to re-evaluate, re-diagnose, and if there is need for more examination, send the patient to go and do the examination, come back with the conclusion, meet 1 or 2 different personnel, discuss about the patient's outcome, and then you can take a new approach. Healthcare is not something for one person. Yes, I'm saying so because the nurses have that tendency of feeling like you want to carry the healthcare system on your head and die with it. No. Sweetheart, if you die today, if you collapse today on duty and you die, they are going to take your corpse to the mortuary and the healthcare system will continue. D, oh yeah, my favorite international nurse. Peace and love from Houston, Texas. Thank you so very much for joining us. Too much love from Cameroon. I'm so appreciative. I hope you had a wonderful day today. So you need to understand that it is a joint effort. It is something I need to be doing in collaboration with another nurse, in collaboration with a student nurse, in collaboration with the doctors, in collaboration with the administration, and most importantly, in collaboration with the patient. Because if the patient refuses the treatment, there is nothing you can do about it. Because while you have rights as doctors, as nurses, they too have rights as patients. So you need to be sure, after you have re-evaluated and you come back and you are like, you know what, I think we had the wrong diagnosis. I think we need to re-strategize. I think we need to stop a treatment. I think we need to start another treatment. You need to bring this information and you communicate that information to the patient. You need to bring this information with the one that is best fit for communication, because there is a lot of fighting and everything, and there is a lot of heated argument that keep taking place in the healthcare system simply because there is lack of effective communication. If I feel like there's a problem, I'm looking at this patient with another dimension, I need to go closer to the doctor and I'm like, Doc, good morning, good afternoon. I know you had a hectic day, but I would like us to evaluate and go through this patient's document, because this is what I feel, or this is what my assessment has proven to be. I think the person is suffering from this and not this. When you have come to the conclusion of that, the doctor will re-evaluate with you. And if he decides to say, you know what, probably you're right, let's get to do this and this and this examination to confirm the diagnosis. Because remember, we are evidence-based. It is not about what you are feeling. It is about what you feel backed with the materials that you have conducted. Now, when you come back with the confirmation that indeed you thought it was a miscarriage, but the woman is having an ectopic pregnancy, you need to approach the patient and tell the patient, you know what? 3 days ago, I thought that 3 days ago, we thought that because of this and because of this, you were having a miscarriage. But just as confirmation with the fact that you are not progressing or you are not healing from any signs of that, we are now coming to a conclusion that you might be having an ectopic pregnancy. And we will need you to go and do an echography for confirmation. Because remember, you are the healthcare personnel. You bring the knowledge while the patient brings the finances. So you need to communicate with the patient to be able to have those finances available for that knowledge to be effective. If the patient accepts with you that everything you have said is okay, they are now going to go ahead to do the echography. And if the echography comes back to confirm your etiology that the patient is suffering from an ectopic pregnancy, you are not just going to take that information and not communicate. You will still communicate with the doctor, and you will still communicate with other team members, and then you, in collaboration with the doctor, will approach the patient for the doctor to tell the patient the next and the possible confirmatory diagnosis that mama, instead of the abortion we thought you had, you are having an ectopic pregnancy, and this ectopic pregnancy necessitates that you be taken to the operation room immediately. And this is because your health is not favorable, and the bleeding you have been having for the past 1 week, 2 weeks, 5 days, 3 days is detrimental to your health. The patient may not know medicine, but they know their body. Patient input count. Perfect. As a nurse, you should never in your life undermine what the patient is telling you. Because you might have the theory, but you are not having their body. Yes, there are times that you can diagnose a patient that is faking, especially when it gets to do with spouse. A wife faking for collapse, convulsion, simply because the husband shouted at her. But you must come to that level of understanding where you can differentiate. You must be able to take for the patient, I am having pains and this pain is not going away. Instead of saying I gave you painkiller 2 hours or 3 hours ago, you are going to wait. Ask the patient, can you rate your pain? So that pain might be a result, that pain might help you to diagnose something else that you do not know. I had an ectopic pregnancy and the nurse was so mean to me. She assumed I was faking the pain to get painkillers. I was hurting so bad. Oh my goodness. I'm so sorry. I'm so sorry about it. I pray that you had your healing. Damian, welcome to my life. I'm sorry I did not greet you. Welcome, welcome, welcome to my life. Didi, it is so bad to even start to think about it, because there are thousands and thousands and thousands of patients that if they want to give you the encounter with nurses, with doctors, and with other healthcare personnel, you are just going to be so tired and wonder, is this the healthcare system that we are struggling to get into? So we want a change, and that is why we are out here making sure that the young generation of nurses that they are coming up are ready for the job. Yesterday, I asked the students to pick themselves, and I could see how they were crying, others were shouting, and they were like, this is painful. I said, that is exactly what I want you to know. Because that pain is what you need to understand that when you want to pick a patient, and the patient says, I'm afraid, you should not curse them out. You should not tell them to just stop because you are trying to do your job and you have 5,000 patients to attend to. No. You need to make them understand that they count, that their pain counts, that even though they are in pain, what you are about to do to them is the best possible way to help them. So you need to be able to put into account their pains. I could have died because a fallopian tube had ruptured and I was bleeding internally. Worst experience ever. I pray you heal. And I want you to understand that having an ectopic pregnancy does not stop you from conceiving again. Because the only one of your fallopian tube has been blocked or destroyed or cut off. The other is very much active. I sent you my love and I sent you my hugs. And I want you to know that there is a system out here that is for you. That we are going to struggle and keep struggling to make sure that the young generations of nurses are not so mean, and not so angry, and not so frustrated. They are able to see the other side of pains and then get to relate to patient in their own shoes and not in the perspective of a nurse. So we are going to the next point, which says that what? Patients education. That is one of the purpose for taking vital, for writing report. Number 4 point is patients education. It is very important that you never take matters into your hand. You always educate the patient. If you are changing their treatment, tell them, because they are part of that care that you are giving to them. Tell the patient, I am going to change your treatment. Tell the patient, I want you to go and do this particular lab, and this is the importance of that lab. Now, I get one thing. Nurses get so angry when they ask them, what is the treatment you are doing? What is the importance of the treatment you're about to administer? Please, I just want to tell you, don't be afraid of that question. It is in their right to know the importance of the medication that you are about to give them. What I am saying is this, Karen, that when it comes, the fourth purpose for report writing is education. You need to educate your patient. And you should not be angry. You should not be that nurse that when they ask you what is the purpose or what is the importance of the treatment you're about to save, and then you blur up. Are you trying to teach me my job? Why do you have to ask me that question? How is that supposed to relate with what I'm about to give you? If you do not want the treatment, I don't have time to waste because I have 10,000 patients to attend to. Yes, it's true. We are not in a developed country whereby you can say, oh, it is 1 per 4 nurses. It's 1 nurse per 4 patients, or 1 nurse per 2 patients, or 1 nurse per patient. We are in a developing country where we'll be looking at 1 nurse per 20 patients. So yes, there is burnout. There is burnout like there is no tomorrow. You go to work, you come back, you're a complete vegetable. You just reach bed. It will even take grace to eat. But I want to tell you, each and every life that is put in before you as a patient counts. And it is better for you to take 1 person at a time and do a better job than rush through 20 patients and allow them all have a problem. And always know where your powers end. Know your limits. Nurses. I am telling this especially to the students. When you're on duty, when you start working, when you go for placement, know your limits. Work only as a nurse. You see the story of the nurse that did, what did they call it? Plastic surgery. Well, I'm sure he's still enjoying jail time. Know who you are. I don't care the number of experience you have had as a nurse, a theater nurse, or as a dentist nurse, or as a pediatrician nurse. You are not the pediatrician. You are not the surgeon. You are not going to be a medical doctor. And therefore, it is necessary 100% for you to know your limits and know where your license are able to cover you to. When I mean your limit, I am talking about the procedures that you should not carry. When I mean your limit, I am talking about the medications that you should not prescribe. When I'm talking about your limit, I'm talking about those procedures that you know very well that at that moment, your patient do not need them. Your patient, if gotten that medication, will be in harm's way. And because you are given that instruction to do, you do it. And you end, the patient dies, they'll put it on you. Because you are the center of attention of the healthcare setting. The healthcare system depends on you for an effective run out, even if you are the last person that is respected in that same healthcare system. When the patient wants clarity, when the patient is in pain, when the patient is in need, they come to you. You are the healthcare, you are the nurse on duty. When the doctor has prescribed and you need that medication to be administered, he comes to you. If something goes wrong, they come to you, the administration come for you. They want you to give answers to that question. So it is necessary for you to learn and learn correctly. It is important for you to learn and learn correctly. It is important for you to go to school, not as a kind of, there is no way out, so I'm not finding myself as a nurse. No. Go to school to be a nurse because you love to be a nurse. Go to school to be a nurse because you are called to be a nurse. Go to school to be a nurse because the only dream you ever had was to be serving somebody. My teacher said a call to save and not to be served. You want to save somebody and not to be served. A call to listen, to be that ear. A call to offer a kind word to somebody that wants to bully you. Because you are going to see patients that come to the hospital and treat you like trash. But then you will still smile and tell the mama that I understand. I know that you are talking from a place of pain. I know that you are talking from a place of frustration. But I want you to know that I'm here to support you and not to ruin you and not to make it worse for you. Karine, do you understand? Ethelyn, I know you're online. So do you understand? 10 planet achieved. Archive. You are an amazing. You should be teaching healthcare providers all over the world. Thank you so very much, 10 planets. I pray someday I'm going to have that opportunity to come back to this comment of yours and say I made it. Thank you so very much. Karine, are you online? Ethelyn, if you're online, let me know. Let me know if you've understood to this point, because we are finished with definition and now we are going through the purpose for report writing. So if you understand why you are writing a report, you will not see any need to remove one thing and put the other. If you know the reason why you are writing your report, you will write a clear, a brief, and a direct to the point report, so that it might enhance and promote care and making sure that you are backed legally to perform every duty that you want to carry out. If you are a nurse on duty in Cameroon, abortion is not permitted. And then you conduct a criminal abortion, and something along the way happened to that woman, and they happen to bring her back to you. My dear, you will go to jail. That is for sure. Your license will be seized. So you should be able to do something that you can be able to stand for, both legally, both morally, and both physically. You should help the patient gain physical health, get psychological health, gain moral health, and be able to say, you know what, I had a good encounter in the hospital. Thank you so very much, Karen. And I know that you are going to grow up and be a good nurse. I want to be old someday, and then I'm like, I have been working for quite some time. Let me go to the hospital and get rest. Before people go to the hospital to get rest, like you want to have leave, you go to the hospital, take 2 weeks, and you sleep on the patient's bed and you rest. But these days, nobody dares that rubbish, because you are not sure if the hospital will kill you when you go there to rest. Because we are now looking like we are the first people that kill the patient even before their illness takes their life. Either by using very harsh words, either by saying very terrible things, either by saying very mean things, making people feel unworthy, unloved, untrusted. You are the one person that is supposed to offer love, kindness, attention. You are the one person that is supposed to sit there and be there for your patient. You are that one smile that when you enter a room and you smile, that whole room lights up. Your touch should bring life. You should just pat a mother and say, it will be okay. And she feels a sense of relief. You should tell somebody that it will be okay. And the person feels like they are feeling okay already. If your words does not bring peace, if your words does not bring healing, then you are an agent of death. If your touch cannot bring calmness, sanity to a patient, you are not to be a nurse. If you enter a room and your smile does not communicate love, if your smile does not tell the person that I am here for you, then we need to find a department for you in the healthcare setting and not nursing. So it is important that as young nurses, you know what you have to do and you know where you need to end. It is important to take note that as a young nurse, you are the light of the world. My parents and your parents, my husband and your husband, my children and your children, our brothers and sisters, depends on you to be the best of your kind so that they can entrust their whole being in your life. Being at the forefront of nursing is actually being the one to receive life. You are the first person at the gate to take in life, to receive life, to bring in somebody onto the surface of this earth. And you are the last person to wave goodbye to someone that is dying. And that is why our job is not completely frustrating. Our job is not completely exhausting. We have that period of light, that period of sunshine, where you are taking care of a patient and seeing progress, where you can count the blessing, because each time one of our patients successfully recovers and goes home, it is a blessing. It is a fulfillment that you as a nurse will always get. But now each time we lose a patient, you go home and you cannot even eat. You feel like, is there something you would have done differently? Is there something you would have done to make it better for the patient? Is there something you would have said that would have made that patient just live for 1 second? Was the patient in need of spiritual counseling? Was the patient in need of physical counseling? Was the patient in need of psychological and mental counseling? Did they die at peace? Did they die in wholeness? Did their goals on earth, were they achieved? You need to come to an agreement and understand your purpose as a nurse in the lives of the patient that you are taking care of. Blandine, welcome to the live. Hello, Madam Group B. When flushing a patient's system, at what rate is it normal saline? At what rate is the normal saline regulated? All right, Blandine, to answer your question straightforward, it is advisable that in a situation where the person is suffering from, say, high sugar level, maybe with a glycemic level of like 500, and you solemnly need to flush that patient's system, it is advisable that you should flush first off with 1000 cc of normal saline, and then with ringer lactate, before you can now put the patient on a regular dosage of probably 12 hourly or 6 hourly or 8 hourly or 4 hourly. You have to rush the other one because we are trying to dilute the blood and then help this patient to urinate, that will, in other words, liberate them from ketoacidosis, from hyperglycemia, as well as a student nurse or as a nurse. When going into this flushing, it is necessary that you get the backup of your doctor. It is necessary that you take the permission of the doctor in order to be able to conduct this flushing. Now, there are other patients, especially old patients, people that are of age. You will need to put in a urinary catheter because we want to be sure. You will need to do creatinine levels of an elderly individual to be sure that their kidneys are active enough and the solution that you are putting into that body is going to come out. If you are not sure about the creatinine levels, if you are not sure about this person's physical or kidney state, then I tell you, you are going to do overload. And when you do rehydration overload to that patient, and something happened, sweetheart, you killed the patient. I always say it plain and clear, so that you should be conscious enough to know that if you mess up, it is on you. You have to deal with that for the rest of your life. Tracy. Okay. If you still do not understand, let me know. Welcome to the live, Tracy. You're just coming to class now. I guess you can ask your questions. If you don't understand, ask me and I'll take it all over. Now, Blandine, do you understand here? Blandine, you asked the question. Do you understand? Sorry, the network is messing with us, but we are going to be fine. So, Blandine, do you understand? Please let me know that that was done so that I can go ahead. Tracy, you can ask your question, all right? That is why I'm here for you guys. You can ask your question. Now let's go to, after we are finished with the purpose of report writing, we will want to know the different types of report writing. And within these different types of report writing, what is necessary? What are you supposed to be writing? Because it is not just you knowing that you are supposed to write report. It is not just you knowing the importance of report writing. It is equally very, very necessary for you to understand the different types of report writing and to write your report in the correct way. Because if we are talking about a new case, if we are talking about a new case which is known as an admission report, what is expected for you to do when you admit a patient in the hospital? It is called an admission report, which I term it a new case for easy and better understanding. When you get a new case, what is expected of you to report to this individual, to tell your teammate, to tell the next team that is coming? What do you have to write on that? Now, the second case we'll be looking at is shift report. That is the recovery report, or it is equally known as a follow-up report. So, a shift report, a recovery report, or a follow-up report, I term it an old case. This is an individual that has been in the hospital for a couple of days, and now we want to know what is an update to their state and to their health, and to see whether or not they can go home or they can stay in the hospital. Number 3, we'll be looking at a discharge report. When you want to discharge, I know for all the students that are on internship now, at least you already know what a discharge report is all about. It's about you doing all the filling of information and all the like. We will get there. Number 4, we'll be talking about an incident report. Maybe, just maybe, while you were on duty, a patient came in with convulsion. A patient came in with convulsion and having respiratory distress, which without noticing or with noticing and because of limited knowledge of the effects, your doctor, your leader, your team leader instructs you to go and administer diazepam. Diazepam is a muscle relaxant, which is going to relax the muscles and stop the individual from convulsion. But should it be given to everybody? No. Diazepam is not meant to be administered to each and every patient. And before you administer diazepam, you must be sure that this is the best possible means of treatment to this particular individual. So, for an example, if you are on duty, a patient comes in convulsing and with respiratory distress, and you decide that the best possible treatment to give to that patient is diazepam, and when you administer that diazepam, you had other reactions, or this diazepam goes and further relaxes the respiratory system of this individual and causes them to lose their life, and causes them to get into a coma, my dear, you need to make an incident report. You need to be able to pen down and indicate that this happened, and this is where the errors were made, and this is where the adjustment has been realized, and we are saying this for the further care, so that other nurses should not do the same error. Or maybe you wanted to take something or to lift some substances up a shaft, and it poured on you, and we realize that maybe it was an acid. That is an incident report. You need to write that under an incident report. So you need to be very, very keen. You need to be very, very patient. And you need to make sure that you are writing the right report pertaining to the right situation. Incident report is one of the reports that are hardly submitted in the nursing field. Yes. Because everyone thinks that they are right. Everyone feels like they do no error and should not be judged. Yes, I know the workload is crazy. The workload is high. Sorry, I want to bring up my lightning. I know the workload is much. The workload is very high. And because of that, errors are bound to happen. But what we are saying is, if the errors happens, please be kind enough to indicate. Do an incident report so that others can learn, so that those errors will not repeat themselves again. And the last report that is to be done is a death report. When you lose a patient, do you just pack the patient and send out without saying anything? No. We just lost a human being, and few seconds are supposed to be respected for the dead. You carry the dead, you bring them out, you put them in the isolation ward, and then you give them a moment of respect before you can make a small prayer, and then you leave. When you go back to the nursing station, you are supposed to give the final minutes that led to the patient waving farewell. When you give those final minutes, and when you put all this into consideration, that is when you are ready. So that so said, I know you have already put in count that we have 5 different types of report, which is 1, admission report, 2, shift or recovery report or follow-up report, 3, discharge report, 4, incident report, and 5, death report. Now, the 2 reports that we are going to be talking about, it is the new case, which is the admission report, and 2, the shift report, which is the old case. Before I start, we will not want to have a situation where the students are not online to learn this. Are you online? Who is online at this moment? So that you need to understand this, and I don't have to repeat myself. I know we started 2 days ago and we are still on the same topic, but we need to gradually get to a level where a student, even though being a level 1 student, you are able to pin down, pick a book, and then realize that this patient is a new case, is an old case, which type of report I need to make to the patient. Good evening, Veram. Welcome to my live today. Ciao. How was your day? I hope you had a wonderful day. Today we are talking on report writing and how the definition of report writing, the purpose of report writing, the types of report writing, and we end up by saying the essential component that is needed for a nursing report writing. Blanding says, I'm online. Yep, what is the topic is today? All right, I just said that right now. I don't know if you heard me right. What I'm saying is the topic today is report writing. How to grow from a student to a professional, in able to present your work, in able to present your documentation, in able to present your case to your supervisor, to the other doctors, that the senior doctors, or to the nurses. Because report writing is about 2 things. You presenting that report to the nurses, and you presenting the report to the doctors and for the better care of the patient. Chichi Karin says, I'm online. All right, we have Karin online. We have Esther is online. We have Tracy. Tracy have not indicated. We have Blandine that is still online. So we are going to go now to give report writing for a new admission, which we call it what? Types of report writing. 1, admission report or a new case. For admission report, what are you looking at? How do you pin down this report as a medical student, as a medical nurse or medical surgical nurse, in making sure that those that are coming to take over shift are going to take over a good, a perfect, a beautiful, well-coined, and an up-to-date report that you have made to be able to continue the care for the betterment of the patient. Now, what you need to understand is that a new report is a detailed report documenting the patient's condition. It is a detailed report that is aimed at documenting the patient's condition, and there we are looking at the following aspects. What hospital management staff does. Okay, please, you bring back your question, Veram. I don't get the question. I don't understand your question, so you can record it and then you send it back. So as a nurse, what do you write as report for a new patient? How do you present a new patient? How do you hand over shift of a new patient? Now, this is the first thing we are looking at when we are looking at a new patient. Karin, take note. Blandine, take note. Evelyn, you are in class. Take note. The first thing we are looking at is the patient's identity. You need to identify your patient to be able to pass on the shift to the next nurses. You need to be able to tell the next nurse that this is Aisha, she is 20 years, she is 22 years, she is 25 years old female. You need to give the bed number. She has been admitted on bed number 5. Now, it is very important that you identify your patient by their names, by their age, and by their bed number, because you might place a patient on bed 1 and then the patient skips from bed 1 and goes to bed 3 because they feel like the bed 3 positioning is comfortable, or they feel like the mattress that is on bed 3 is a little bit thicker, so they go to bed 3. Okay, so they go to bed 3, and when they go to bed 3, you might send somebody to come and do treatment, and you're like, the patient is on bed 2. They get to bed 2 when you had admitted a new patient on that bed 2, and you now give the patient on bed 2 the treatment for the patient that was supposed to be, that has already moved to bed 3. You need to be keen. So when you are identifying your patient, identify your patient by their names, by their age, and by their bed number. Veram say healthcare management professionals oversee medical teams, coordinate patients' care, and help improve operations in the medical facility. The professional possesses high level of organization communication skills, which is the one that I cry every day, because if we do not, as nurses, as doctors, if we do not see our importance in the nursing, in the healthcare career or in the healthcare field, we will be used as tissues to clean the bosses, which are the administrators of the hospital. Because one thing you should understand is that the administrator is business inclined, and administrator's sole interest is the business that is inside health. The doctor's sole interest is treating the patient, as well as the nurse's sole interest is making sure that the patient receives the best possible care, quick and facilitated recovery without going home with another nosocomial infection, and in so doing, trying to meet up with the financial needs of the hospital, that the patient should not run away. Yes, I know in developed countries, you guys don't know what they call patient running away. In Africa, they run away every day. So you can treat a patient and the next 5 minutes, they disappear. And then the healthcare is there to cover up those expenses because they are not able to collect their money from the person that they had given healthcare to. And the most people that suffers are the nurses. We get to work, we get to be underpaid, we get not to be paid in other hospitals. Others work for a period of time, then you are dismissed, then a new set come in because they don't want to pay. So it is a messy war. We need to work together to make that system change. Number 2, I have said that identifying a patient, you need to identify them by their names, by their age, by their sex, and by their birth number. Under still number 2 point, you need to give patients presenting complaint. It means that after you have identified your patient, after you have indicated the diagnosis, so it will be Aisha, 20 years of age, female, the diagnosis she's suffering from severe malaria and anemia. After I have come out with the birth number, with the name, with the identification, I now go to start with doing what? Because it is a new patient, you need to tell us that Aisha, a 22 years old lady, came to the hospital with a temperature or with an initial virus. With an initial virus of maybe 40 degrees centigrade, a BP of 120 on 80, a pulse of 100 or 95 or 90, and a glycemia of 450, which is indicating that the person is super hyper anemic. When you have presented the initial signs and symptoms, your initial virus that you received to that patient, the first encounter with that patient, now you are orienting the healthcare team, the individual that you are taking over, that this patient came to the hospital for this particular reason. I should know that there was fever. When you have finished giving the vital signs that brought that patient to the hospital, we need you to go ahead to giving them what? The presenting complaint. When I mean presenting complaint, what I'm talking about is Karen. The presenting complaint are those signs and symptoms that brought that patient to the hospital. What happened? When you are consulting, you ask Mama, what brought you to the hospital? And she will tell you, I came to the hospital because I have headache, I had pain, I had joint pain, I've been vomiting, I have diarrhea, I have nausea, I've had cough for the past 2 weeks and it's not stopping. I've been bleeding for the past 2 weeks and I don't understand what is going on. I have severe abdominal or pelvic pain. I have pain at the flanks. Then that is what brought you to the hospital. That is what you call your presenting complaint. No, Vikram. When it concerns report writing, everybody is writing report at their own level. As a healthcare personnel, as a nurse, we do report writing and handover per shift. I know that you might not necessarily understand because you are a medical student, and a medical student you just go ahead and you check on your patients, you take the books and then you verify everything. But still, as a doctor or as a future doctor, you are going to realize that you will need the nurse to give you the update on what is going on with a particular patient. And that will be first hand presentation, and that presentation is being done after another nurse had done that handover, which is the report writing. Veram, are we together? Veram, are you there? Do you understand now? Karine, are you online? Blandine, Ethlyn, if you're there, let me know that you're there. If you have gone to study, I don't know what you're writing tomorrow. You did not tell me what you'll be writing tomorrow. So when we are talking, okay, Karen is still online. When we are talking about the presenting complaint, under the presenting complaint, we'll be looking at what brought the patient to the hospital and for how long they have been suffering from it. So for new cases, the first thing we are looking about is identification of the patient, which includes what? Their age, their sex, their name, their birth number, and their birth number. When we go to number 2 under new cases, we'll be looking at presenting of the presenting complaint. But before we talk about the presenting complaint, we will have to start with 1. The vital signs, the initial data. Good evening, patients. How are you doing? How was your journey? I guess you arrived well. How are you doing? How's your husband? How's his health now? All right. So while we go ahead, it is very important to take with recount to reasons why the patient is in the hospital and the duration for which they have been sick. Now, to break down, if you are taking a patient that is suffering from cough, who had been sick for, let's say the cough started 2 days ago, and she's having chest pain, and it's severe, and the person comes to the hospital and tells you, doctor, when you took the consultation, the person protects to the doctor, I've been having cough for the past 2 weeks. No, for the past 2 days. And another person comes and says, I've been having cough for the past 2 weeks. Those are 2 different disease conditions. They will have 2 different diagnoses. While one person will be having an upper respiratory tract infection that is related to or possibility of pneumonia, the other person will be talking about tuberculosis. So they have come to the hospital with the same complaint, but their duration of that complaint does not look like somebody that is having the same disease condition. I'll take number 2. Example number 2. For somebody that comes to the hospital, for a lady that comes to the hospital with menstrual cramps, doctor, I'm on menses and I'm having severe menstrual cramps. How long has your menses been? It started yesterday. It started the day before yesterday. With somebody that comes to the hospital and says, doctor, I'm having severe menstrual cramps. And you ask, when did it start? He says, since 2 days, since 2 weeks. And you are like, oh, 1 week. Have you been bleeding for 1 week? And the person says, yes, I've been bleeding for 1 week. Or I've been bleeding for 2 weeks. The diagnoses are not the same. Just because of the duration of the disease condition, it changes 100 degrees, 360 degrees all around. They are not the same disease conditions, and they will have different diagnoses simply because of the duration of the illness. Yes, that is very true. Doctors do not get to know much about the nurse's perspective of care, especially when we are talking about the developed countries, because they just come, they take the books, and then you present a patient, and when you present the patient, they take it up from there, they add what they want to add out, they remove what they want to remove, and then they hand over the shift, and they are gone. But in Cameroon, in Africa, in my place of work, the doctors are in the office during the period of handing over. You have to be there to listen to the report. Because if there are emergencies, you need to get it firsthand. Because getting it from the second nurse is like passing it from two different persons before it get to you. There will be Maggi or there will be salt added and removed. We don't want that. You need to be there and get this information with your own ears and know how to move on from there. Same symptoms, but etiology is different. Exactly. That is it. They are the same symptoms, but their etiology is different. The diagnosis is different. Simply because you just told them the duration of that disease condition. So you never forget how long a disease condition is, because that duration will help you direct you to where the diagnosis might be found. Hey ma'am, I'm just there. My stomach still disturbing and I'm still on the way. Oh, Ataya had a problem. Oh my dear, I'm so sorry. Okay, I hope you took some medications. If not, you can get some hot tea on your way going. It's going to help relieve you from the cramps. I share strength, mother, strength. You're having a whole team supporting you. All right, so after you have indicated the identity of the patient, after you have given the presenting complaint of the patient, the next thing you're going to do is the medical history. What you are going to be penning down is the medical history. And when you pen down the medical history of the patient, you are trying to ask the patient, which medications have you taken before coming to the hospital? Especially when the patient has been on treatment for the past, when the patient has been suffering from the past 2 weeks, 1 week, 5 days, there is no possibility that they were in the house for 5 days without taking treatment. Come on, Peter phone. There is no possibility that they were in the house for the past 5 days without taking any treatment. They were on treatment. So you need to ask them, which treatment have you been taking? When they tell you the treatment they have been taking, this will help you know the possibility of a resistance to that particular treatment, especially for patients that are suffering from typhoid. Imagine you take Cipro in the house and then it did not work. You still came back with severe signs and symptoms of typhoid. I cannot be prescribing Cipro, or the doctor will not prescribe Cipro again, simply because if he or she took Cipro and it did not work out, why will I still give Cipro in the hospital? There is evidence of resistance and there is evidence of the fact that the medication yielded little or no effect. Now, when you are done asking which medication they came out from, they took before coming to the hospital, it is very important for you to ask two important questions. And question number one is, are you allergic to any medication? Now, to those that are in a malaria-infested environment, like us in the tropical areas, if you are going to administer quinine to the patient, and the patient is having allergy to quinine, will you go ahead to administer quinine? No. You cannot be administering quinine to a patient that is suffering from, that has an allergy to quinine. You will now be thinking of artesunate. You will think of another line of treatment. You think of another line of treatment that will be suitable enough to that patient. If the patient says, I'm allergic to Cipro, you are not going to be giving the patient Cipro, and that has to be indicated on the patient's card that the patient is allergic to this particular medication. That way it helps to make sure that we are getting the right care and we are safe, and it is okay to give this particular treatment to that patient. Vikram, you said, I'm always confused in menstrual symptoms. You are confused with menstrual symptoms from what? Because you need to be giving me what you are confused with. Menstrual symptoms and what? What are you need to be, what makes you confused is two different things. If you say you are confused with identical twins, that is because they are two people and you cannot differentiate them. What are you confused with? Menstrual symptoms with what? After you have given the allergy, it is important for you to ask this other question. Have you been transfused before? Now, if the patient has been transfused before, this is going to help you understand, give you, if there's a possibility of another anemia. They should tell you the reason for which they were transfused. They will tell you the reason for which they were transfused. And they will equally tell you whether or not it is an important aspect for them to make note of. If that patient is sickle cell, immediately you ask the patient, have you been transfused before? The person will tell you, yes, I've been transfused before. And I've been transfused because of this. This will help you to understand that this individual is suffering from sickle cell. Has the individual been operated before? Now, their operational history or their series of operations will guide you. Imagine that the patient came to the hospital because of abdominal pains, and you are suspecting an obstruction. And the person says, yes, I've been operated before. How many times? 2 times, 3 times, 4 times. And this operation, what was the purpose of the operation? Because of this, because of that. Then it will make you to understand that there is possibility of adhesions. This is how we help the doctors to come out with a perfect diagnosis, because sometimes they ask these questions and the patient do not see any reason or the importance for those questions. But now when they bring that patient to you and you are now going to hospitalize the patient, you're not trying to get to know the patient better. You're not trying to see how you can help them in the best possible way. And this is going to help you to come with the best outcomes or with the best possible diagnosis. Patience, are you online? Do you understand what I'm talking about? Blandine, are you there? Karine, are you online? For Ethelyn, I know Ethelyn is surely not online. She's writing her exams now. So I get that Ethelyn might be studying. Hey, Ma Eugene. Good evening. Good evening. Thank you for joining. If you are joining for the very first time, I want to say welcome to my live video. This is Nurse Aisha, and we are struggling to give back to the community what the community has given us. And that is knowledge, and that is to build up a community of nurses that are conscious, that are loving, that are kind, that are peaceful, that could come to the world and make a change, that could come to the healthcare system and make a change. For we need that change. Now, let's go to, after we have given the allergies, and then one last important question. Are you on a particular type of medication that you take daily? If it is a hypertensive patient and is on treatment, the patient will tell you, I'm hypertensive and I'm on treatment. If the patient is an HIV patient and they are on treatment, they will tell you, I am on treatment. That way, it already directs you on which direction to go. So these are the things you are going to pen down. You are going to indicate in your report that this patient, Nurse Aisha, 50 years or 60 years of age, blah, 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 blah. She's coming to the hospital with initial data. You give my initial data, that is the pulse, the BP, the temperature, the glycemia that I came with, the HB that was noticed. From there, the presenting complaint. Her presenting complaint was headache, fever, cough, nausea and vomiting, diarrhea, abdominal pains. From there, we will be talking about she is allergic to or she has no history of allergy. She has been transfused 3 times, with the last time being what? The 15th of May, the 20th of May, or the last time being the 5th or the 4th of June. What was the indication for transfusion? She was transfused because of anemia. Is a patient that is suffering from sickle cell. That already gives you an impression, okay, if it's a sickle cell patient, then I should be looking at this. I should be looking at this. There's a possibility of this. There might be crisis during my shift. You need to make the other nurses come in terms with that. Hey, Hans. Good evening. How are you doing? How is America today? So you need to come to terms with this information. You need to be sure that this patient have not been transfused on any rate. If they tell you have been transfused before, that is 5 years ago. Indication AHI was operated upon. It's okay. It's 5 years ago. Thank you so very much. How was your day today? It's 5 years ago. So you get to understand and you are okay with that. Now, if you go now to their surgery, have you been operated before? Good evening, Eugene. Good evening. How are you doing? Thank you so very much. I'm grateful that you are spending today with us. So when you see this, when you get this consultation book and you see this information, it helps you to come out with your possible difficulties, your challenges that you are going to be having within that period of duty. After you have finished with knowing if they are transfused, you should go ahead to ask them about, you should go ahead to check what they responded as their surgical history. If the person says that I have been operated 5 times for ovarian cyst and she is still coming with the same pelvic pain, there's a possibility for another ovarian cyst. So we should be sending her to go and do echography. We should be insisting that she does echography. And then if you are not coming to check on her medical history, what has she been taking? Is there any regular medication she takes? And you get yes, antiretrovirus. Your patient is HIV positive. You should be able to protect yourself from contamination and protect the patient from getting a disease condition, because when they are positive, if they were not taking treatment, their immune system probably is weak and they can contaminate and they can get contaminated or carry any infection that is in the hospital. So as much as you are protecting yourself from being infected, you should be protecting them from contracting other disease conditions. Thank you so very much. I'm so appreciative of what you just said. Thank you for your kind words. So you get to understand, you get to know the steps in which you are supposed to take to see that this is your report is perfect. When you finish with your presenting complaint and you finish with your medical history, the next thing is to check which labs were requested. What did the doctor request that the patient should go and do as labs? When you check their labs, you will now realize that they were asked to do malaria, they were asked to do typhoid, they were asked to do H. pylori, they were asked to do glycemia, they were asked to do HIV, they were HIV tests, they were asked to do hepatitis, they were asked to do chlamydia. You need to tell us during the report writing that series of labs were requested. HIV, this, and that were requested for the patient to do. You need to tell us if the patient did all the labs that were requested, or if there was a particular lab that was not yet done and you want us to do the follow-up to make sure that that lab is done. If there was an X-ray to be done and it has not been done, you need to tell us that we need to persuade the patient to pay for that X-ray and go and do it. And when the results are back, we should send it to this particular doctor that conducted the consultation. Because there might be 10 doctors on duty and a particular doctor consulted that patient. You need to send that result to that doctor and the doctor tells you what to go ahead with. Because today a patient might be seen by Dr. A and tomorrow the patient is seen by Dr. B. If you do not coherently write your report in such a way that there is handover and there is effective communication between you and your teammate, you might take an echography, that you might take a result and you don't present it to the right person who already knows what that patient came with, and you present it to the wrong person only to get that information mixed. You as the nurse is to be blamed. Yes, echographies, we have the pelvic echography, which is equally known as the obstetric echography. That can be used to determine any growth or a cancer, that can be used to determine any growth in the uterus, or that can be used to determine an ectopic pregnancy, or that can be used to observe a baby and its activities or sex in the uterus. And then there is another echography, which is an abdominal ecography, that is used to monitor all the internal organs of the abdomen. So when we have checked the request, that the lab request that was done by the doctor, and we indicate, we need to say that this and this and this and this were requested for the patient to do. And after it's been done, and after it's been done, the results came out to be malaria was positive at maybe 2,000 trophozoid, or typhoid was positive, maybe all the strands of typhoid was positive, or some of them was positive, or you need to say CRP was positive at 95 milligrams per liter. Is that understood? Karine, are you online? Because you are going to do the assignment I will give you at the end of the day, and you're going to send it to my WhatsApp number so that I control it, and then I'll confirm if you understood. Because you've not been in the hospital for these days, and I don't want you to lose anything. Beautiful. I'm happy that you're following up. So after we have completed with the labs that were requested and the results that came out from the lab, we will now go to give what? Action. What action was taken? The doctor placed the patient on anti-malaria drugs and antibiotics. If the doctor placed the patient on anti-malaria drugs or antibiotics, now what is expected? Artesunate 240 milligrams was prescribed. H0, H12, H24, H48. Or artesunate 3 days, ceftriaxone was prescribed for 3 days, which we have done, and it will continue in our shift, or will continue in your shift. It was 12 hourly, it was 24 hourly. You need to bring out the action plan. What was done? which prescription has been done. Have you served the treatment, or are we to serve the treatment, or are you handing over for the next team to serve? Have you planned that treatment for continuous care? If you have served the treatment but you have not planned, you need to indicate in your report that treatment, this and this and this and this prescribed for these numbers of days, which was safe, plan. So we are pleading that you plan it in your shift. So we are indicating that you should plan it in your shift. Thank you so very much, Hans. Have a wonderful day. Have the most gorgeous day today. When you reach at the work site, please take one juice for my name and for your B. You can put my name there and you can pay for yourself. That is me being generous today. No, it's not generosity. It's out of my heart. For my B, for my name, but your B. So this is the number. After you have already indicated the plan of action, what you did after the lab's results came out. Thank you so very much. So it's not easy. No matter how bad the situation is, we are going to stay, we are going to grow, and we are going to live up. All right, so continuing, we'll be talking about presentation. I was talking about to end your report. You are going to talk about to present the evaluation and the follow-up care. Karine, are you online? I don't even have Wi-Fi. I'm using mobile data. So for me to be here, I actually sacrifice a lot. All right. So if you followed up right up to this moment, we will now be talking about the last point, which is evaluation and follow-up. The evaluation, which evaluation do you have? And then you can now follow up with care. Yes, ma'am. Yes, ma'am. Yes, no, okay. I said Instagram message, but you do not send what? I did not see. Please do send it back. I will check it. I did not see the message. I will check, okay? I will check. Sorry about that. I always respond to my messages. All right. Karen, if we are talking now about evaluation, this patient came into the hospital in the morning, let's say 8 a.m. in the morning, and by 9, the patient has started treatment. By 5, where you are now going to give your report, by 5, when you start giving out your report, you need to tell the... Yes, Karen is a nurse. Blandine is a nurse. Tracy is a nurse. Ethelene is a nurse. So if I'm calling them by names and I'm asking them to pay attention, it's because they are my students. So they are all nurses. So we are talking about the follow-up. The follow-up, the evaluation, after you had received your patient for that day and you have taken care of that patient to the evening period, you need to tell the others, or you need to tell the next team what your treatment, your first line treatment, how it has helped the patient, and now how the patient is going to continue care. So if the patient came to the hospital with a temperature of 40.5 and we started treatment and Adrin was saved or paracetamol was saved, it is necessary for me, after that treatment has been done, I now go to indicate that what? The patient came in with a temperature of 40 and by 3 or 3:30 or 4, the temperature was rechecked, which came out 38.5 or 39, indicating a slight increase, a slight progress in the treatment, and we are pleading that the next nurse to continue surveillance, to continue supervision, to continue monitoring, and then intervene as need be. Is that understand? Is that understood, Karen? Karen, are you with me? Do you understand? Karen, Vigram is talking to you. Vigram is a medical student. So, yes, even being a student, he's still our boss. He's our senior colleague.
Right now, that I'm okay.
Is it understood? Karine, if you're there, you let me know, because from here we'll be moving to shift report. That is report after a day or 2 days hospitalization. Until I can help you hold your medical booklet and usher you to the patients that I've been caring for. Karen, are you there? Karen, if you're online, you indicate so that I do a breakdown of the admission of a new patient. And if you understand up to that level, we can go now to report writing for an old patient. Karen, are you online? Let me do a breakdown of what you have to write, and then if you understand, we'll go now to report writing for an old patient. All right, so I will do the breakdown because I have explained a lot within the period of time. I am hoping you are indicating, you are jotting, because I already told your colleagues at work today that you must be able to jot, because you know me. When I now start giving the assignment, I'm expecting an effective carry on of duty, and not you coming to ask again for another question, which I will still answer. You know already. So let's go ahead. For new cases, which is admission report, we are looking at one, the identification of the patient. I've already told you what it takes or what you need to put under the identification of patient. 2, we are looking at presenting complaint. I've equally indicated what you need to be looking at under the presenting complaint. 3, we'll be looking at past medical history. I have already explained what the past medical history is all about and what you'll be looking under past medical history. Number 4, we will be looking at the laboratory that were requested by the doctor. What did the doctor request for? And which of them has been done? Network, should I start again? Do you now have network? Are you not having network? Chichi, Karen, are you not having network? So we'll start with, I said we start with the patient's identification. Okay, thank you very much. We'll start with the patient's identification. You need to identify the patient. You're welcome. You start with the patient's identification. You need to identify the patient. From there, you go to the presenting complaint. I already indicate the components under presenting complaint. After which, you go to medical history, past medical history. What did they take as medication before coming to the hospital? What are they allergic for? What are they allergic to? Which medication are they currently taking that for everyday use? And if they have been operated or transfused before. From there, you need to bring us to which labs were requested by the doctor and which of them has been done, which of them was not done, What are we going to do to help if with regards to the labs? Now, if the patient needed to go to another hospital to do, say, a serology test, yes. If the patient wants to go to another hospital to do a serology test or to do any of the tests that is required, to do an ACG, to do a brain scan, and we don't have it in our institution and the person has to go and do it in another institution, you need to write it in your report that, okay, that is good. You need to write in your report and indicate that the patient has done this and this and this labs, and they came out to be this and they came out to be that, and you are indicating that these results were requested. The patient has not done it yet because they need to go to another hospital. If we have to provide that patient with an emergency car to go to that hospital or with the assistance of a nurse to go with the patient, you need to tell us so that the lead nurse on duty at that moment make arrangements for who is going with that patient and how they are going to come back. And when they bring the result, she needs to snap, or he needs to snap, or he needs to call the doctor on call and give updates about the results that were sent in. And if it is a night shift and you are not in the morning and the doctors are present, you need to take that result to the doctor so that he can see the updates and know what to change in the patient's treatment. Results and action. After these results, after the lab results came out from the lab, what was done? You need to tell the team what was done. Which treatment was prescribed? Malaria was given, Ringer lactate was given, normal saline was given plus 2 Baco, Vogalin was given to stop vomiting. This was, you need to tell us all the medication that was given, and then you need to tell us how long this medication was prescribed for, and if you have served it or plan it for continuation of care. When you have finished talking about your action, you now talk about what? The presenting evaluation and follow up. The presenting evaluation here, presenting evaluation and follow up. The presenting evaluation here is you telling the nurses or the doctors that are present listening to you that the patient came with vomiting. At this moment, we have not observed any episode of vomiting. The patient came with diarrhea and has been in the hospital after the administration of Rogalin and the person taking ORS. We have not observed any episodes of diarrhea. As of now, the patient came in with fever, headache. We have not observed any episode of headache or episode of fever. That is now a follow-up. Now, when you want to leave finish the listen, you are pleading that the remaining team should follow up with the person's blood pressure, with the patient's temperature, and to see that they give effective intervention because of the very high trophozoite of malaria, the patient is liable to convulsion and high temperatures. Is that understood? And that will be the end of your report for a new patient. Karen, is that understood? Karen, are you here? Karen, is that understood? If we finish on the reports for a new patient, we'll go for report for an old patient. Welcome to my live. This is Nurse Aisha. This is a transformatory video for from a student to a professional nurse report writing. If it's understood, please, Karin, let me know so that I go to the follow-up or the shift report writing, which I will term an old case. Thank you so very much, Veram. Thank you. I do appreciate. Karin, are you online? Are we communicating? If you can't indicate okay, then I don't know if I'm talking to the right audience. If you're joining my live for the first time, please share. Please share. Subscribe to the channel so that we get encouraged and we'll be here to give more enlightened messages. Today it might be the healthcare nurse. Today it might be the nurse. Tomorrow it might be your own case. Thank you so very much. All right. In that case, Karin has responded. We will be going to report writing of shift report. Shift report, remember I said we are going to talk just on two, which is the new case, and the shift report, which is the old case. I want to do postgraduate emergency medicine course after my MP, ma'am. That would be a very, very, very good thing. But when I will always advise anyone that is going to an emergency department to equally consider doing psychology. So if you are taking the emergency department, please don't joke with your psychology. This is because the history has it that history has it that most of the people that commit suicide, especially if they are healthcare inclined, are workers from the emergency department. Yes, because while we as medical and surgical nurses experience a glimpse of hope. All right, okay, I will continue. Let me explain this to Vikram. Experience a glimpse of hope with healing, with the excitement, with the fulfillment of our profession as nurses, because you can only be fulfilled when you keep seeing patient coming in and going out, a patient coming in on the wheelchair and then going out and telling you that thank you, you did a magnificent job. But when you are in the emergency unit and it is a referral hospital, you realize that all the patients that are sent to the referral hospital are patients that are near death. And if you are talking and if you are trying to control and you are trying to work on patients that are near death, you always have deaths in the hospital. And you will need to guide your mental health to understand that this is not as a result of your doing. It's a result of the fact that the patients are sent to you either in a very poor timing, or the patient are sent to you when they are in critical or acute situation, and there is nothing you or anybody could have done to change the story. So emergency nursing, emergency medicine is a very, very good course, but please, when you are there, take your psychology courses seriously, because they're going to help you to guide you on how to present and guard your mental health. If not, you have heard of stories of many nurses that have flipped over buildings and fall to their death because they could not take the depression, the loss, the grief every day. You're going to be a fine doctor. Believe you me. All right, let's continue with our shift report. And the shift report here will be talking about, I term it O case. And the O case is someone that has been in the hospital for 2, for 3, for 4, for 5, or for 6 days. That simply means it's an old patient. It is not more a patient that you are receiving that day. And if we are looking at an old patient, it is simple. It is a summary of the patient's condition and care during that specific shift. It means that it is not about how long. It is not about whether the people in the morning did what, whether the people yesterday did what. No. A follow-up shift is what happened in your shift at that moment. So most at times when we are talking about follow-up shift, we'll be like a 50-year-old female patient, or the Aishatu, 50 years of age, patient on bed this room this. Diagnosis, we have gastroenteritis. Patient on day 4 hospice, she is doing well and is responding well to her treatment. Her malaria protocol at least not age 48, which is the last dose, will be served in your shift. You are indicating for the next nurses to understand that they are the last people to save that treatment. As well as the patient is due for his last dose of double antibiotics or triple antibiotics. This your due in your shift. So they know that they have to save that patient's last atisnat. They have to save that patient's last antibiotics. The patient is doing well. He or she spent a calm shift with no complaint forwarded. Please continue with care and treatment. The vital signs of the patient this morning is this and that and that and that. For a healthy patient, for a patient that has gone through the course of treatment and has excellent effects and has yielded and responded well to treatment. On the other hand, if you were taking or if you are doing report writing for a patient that is not healthy, that is not recovering, let's say the patient came with vomiting and diarrhea, and at that period of time that you are writing report, the patient is still suffering from diarrhea or from fever, and this is the 3rd day. You indicate their names, you indicate their age, you indicate their diagnosis, and then you go ahead to indicate that patient on day 2 hospice, she is doing well. No, patient on day 2 hospice, treatment was served as planned. During our shift at this and this period in time, the patient complained of diarrhea or the patient complains of fever, to which to which paracetamol 1 gram was served, or the patient complained of fever, to which Anagin 1 gram was served, which yielded little or no effect. Or if it yielded good effect, you temperature for 24 and 24, and the patient was on 40. No matter what we did, nothing changed. So you need to indicate the patient had fever throughout the night. And when you say the patient had fever throughout the night, we need you to give us the raw data on when and where the patient had fever. At 2 o'clock or at 9 p.m., the patient had fever of this. Anagin 1 ampoule was served, or Anagin 2 ampoules were served. At 12 o'clock, there was a monitoring, and the patient's temperature has reduced by 0.5. The patient is now having a temperature of 38.5. Now at 2 a.m., we remonitored the temperature, and the temperature has skyrocketed to 40. Then there is a problem. And now you are indicating that due to the interventions and the control, physical measures were taken, nothing, the patient did not yield to effect. This and this, I suspected that it could be this or it could be this. CRP was done, which came out positive. I am pleading that the doctors should reevaluate the patient, and modification of treatment can be done if possible. Continue with care and treatment. The temperature this morning is this and this and this, or the pulse this morning is the BP this morning is that and that and that. That is for follow-up or a shift report or a recovery report. They are the same. Now, is that understood? Karin, do you understand? Karine, I'm with you. Any other student, the student that are online, please leave a comment so that I know that you are online. So that I try to find out if you understand what I'm talking about. Do you understand? If you are watching me for the very first time, I'm Nes Aisha. Please, as you're coming in, leave a message or leave a note or leave a comment telling us where you're watching from so that we might extend greetings and love to you in your own language. That is why they say nurses have to learn German, we have to learn Arabic, we have to learn English, we have to learn French to be able to give effective care with response to the type of patients or clients that we have. Karen, is that understood? I hope you are not having network problem because I'm probably sure you're getting me. But I need to understand that you understand recovery shift. The best report you can, or the easiest report to write is a report, is a shift report. Sometimes it does not need to be long. It is most at times short and straightforward. And what takes time, we are talking about the admission report. We need to understand that the admission report has to be all right. The admission report, if you're having 4, 5, 6, 7, or 10 new admission patients, you need to be starting your report from 1 o'clock. Because by the time you present 10 patients completely, you must have spent 2 hours or 3 hours writing that report. But if you're having just the follow-up cases in the ward and you don't have any admission that day, you can start your report at 4 and by 5 you're done. Now let's go to generally. When it concerns report writing, generally, what do we take into account? How you can conduct your report no matter which area, what should be at the back of your head? What should you put in mind that these are the components that are needed for an effective and a good report write-up? So number 1, for the essential components of report writing, please, Karen, pen that down. It is not time for us to take knowledge and then we forget and then we'll come back to start again from square one. For report writing, or the components for an effective report writing goes as those. We have 1, patient's identification. So whether you are writing a new case or you are writing an old case, you need to identify your patient. Is that understood? So identification is a general component for whether it is an old case or it is a new case. And then the next component is date and time. When you are writing your report, you cannot write report without indicating the date of that day. Because if you don't indicate that day, what makes the report a report of that day? It could be the report of any other day. Number 2, it is equally important for you to indicate the time of the different activities that you conducted on that patient on that particular day. So if you monitor the vitals, you need to indicate the times in which this monitoring was being done, their values and their interventions that were carried out after the results came out good or bad. As well as after you have written your data, generally whether it is a new case or it is an old case, we need the assessment. And under the assessment, I will say it again. We are talking here on detailed observation of the patient. Whether you're a new case or you're an old case, you need to do observation. And the observation here will be detailed observation of the patient physical. You need to check the patient physically, mentally, and emotional states, as well as you need to include their status, their vital signs, their pain level, and abnormal findings. So if you, after checking all that, you realize that the temperature was high, the BP is high, or the person is vomiting, and this is consistent, you need to include that and say that this is what you find out, and this is what is not supposed to be there, and this is your interventions that you did to make that happen. Did you warm the food? Did you warm that food?
It's only 5 plantains.
This evening, warm it. And I don't want to hear crack. Karen, is that understood? So for the component, we'll be talking about first, identification of the patient, 2, date and time, 3, assessment, and then we talk about 4, intervention. When you assess the patient physically, mentally, and emotionally, what were your results? And depending on your results, what were your interventions? So your result is going to help you to get the interventions that follows for that patient. Now to continue, number 5, we'll be talking about the evaluation. Now, the evaluation comes to play to evaluate what you have done as an intervention. So after you have intervened, you are now evaluating. You are coming to evaluate what you have been doing for that patient. You will check the temperature, it was 40. You came in, you gave para, which is your intervention. After 2 to 3 hours, you came and re-evaluate and check the patient with the temperature now at 37.5. That is you evaluating. That, and the last but not the least, is the planning and the planification. So tomorrow, God being so kind, we will throw some more light on planification, how to plan for a patient, a nursing care plan. Each patient should be having a care plan, not going to the hospitals where everybody just come in the morning, pick a book, other patients are treatment are given, others are not given, or you need connection for your treatment to be given and to be given on time. No. Malpractice isn't one of them. You need to take those boxes and stop working. You need to be sure that you are able to practice and to plan each and every care that is supposed to be given to a patient. If they have to be changed, if they have to change their diapers, check that stove, that there is no side that is open. I'm getting gas. You have to be sure that you have planned every care that is supposed to be given to that patient. And when you have planned the care that is supposed to be given to that patient, now every care that is supposed to be given to this person, and when you have finished with your care, when you have finished with your planification, effective handover has been done. Effective handover will be done. Effective handover had been. Now they will just continue to evaluate and to reinvest and to re-monitor and to start their own duty from the time you left for them. Is that understood? Karine, do you understand what I have been talking about for an hour now? Good night, good night, good night. Good night, sweetheart, for me. Karine, do you understand? Was the information passed? Was the communication effective? Vigram, are you still online? Good evening, good evening. If you are joining me for the very first time, I say thank you. I say may God bless you. I say as we try to dive in a perfect health, may your health be preserved. As we are trying to dive in a perfect health, may your health be preserved, and may you not waste money on hospital bills. Thank you so very much. Karine, was that understood? Yes, ma'am. All right. Now, I have been talking. So I have completely done with report writing. That is new admission and shift admission and shift report. If you're having any questions, you can bring forward your questions and then we'll start answering them until the end of the class where there are no more questions to be asked. Should I stop the live and restart it? If yes, then check that out. Should I stop the live and restart it? Or should we just continue as of now? I'm waiting. Now it's time for questioning. Karine, it's time for questioning. I should get where you did not understand. I should get where you need clarification from. And we can now know that there was effective communication. Did you off the gas button? Did you off the gas button? Yes, I'm waiting. Vikram, if you have any questions, please, you can bring it forward now so that I can see into it. If we will answer it now or we'll answer it later. No, ma'am, I do not have any question. Thank you so very much. I'm so grateful for your support. Thank you so very much. Yes, any question, Karine? I want to ask about. All right, you have written in short. Can you take the question again? Can you take your question again? You want to ask about what? I'm not getting what you're trying to write. You put it in short. Yes, an emergency related question. Okay, go ahead. You can go ahead, my dear. Cardiac life support or basic life support question. No problem. If I can answer, I will answer. If it's more than me, we'll send it for the live for tomorrow so that I research on it and then I can chip in my own thinking about it. Yeah, send in your questions, no matter which direction you are. Let's see how we can answer some of those questions and come to clarity. All right, ma'am. In the next live, I will ask the question. All right, no problem. No problem. That is still good by me. Karin, are you in class? Ask your questions so that you get clarity on it. Ask your questions if there's somewhere you do not understand. Ask your questions somewhere where you're having doubts. No, ma'am, I did not have any I don't have any question. All right, Karin says that she does not have any question. All right, Karin. So do you understand perfectly well what the report is all about? If you understand, can I give you an exercise to which you will do and send to me? Karin, I'm talking to you. And for any other student that is online, because I know that there are some that keep complaining, they don't know where they are commenting. Karin, should I give you a question to give me a new patient report on it? Let's start with the new patient, because if you understand for a new patient, it is easier for you to understand an old patient. Karin, are you with me? I need you to confirm so that I give you what I want to give you as an exercise. You submit that to me on duty on Saturday. That is if you start feeling better. All right. Okay, take this data flow. We have patient's name. The patient's name is Kari. Not you, but this other patient. The name is Karen. She is 42 years of age. She is resident in Jouvence. She came to the hospital and the sugar level was 102. She came to the hospital, the sugar level was 102. Her BP was 130 on 102. The pulse was 82. And her temperature was 40.5 degrees centigrade. Your network is not the best. So that's to say you are not going to hear what I'm saying? Is that so? Should I stop the light and the live and start it all over? Maybe it might regulate some of the network. Hey, Karen. Should I stop the live and start it all over?